So the lessons that we've learned through T2 is that there was kind of a void between the microbiology and our physicians. Microbiology is excellent at doing benchtop work, getting us the resources that we need, the tests that we need, but applying that clinically can sometimes be challenging for the microbiologists. And then as far as the physicians go, they're very good at diagnosing and managing patients, but sometimes the diagnostic tests, they're coming out so quickly, it's kind of hard to keep up with them. So we found a niche for pharmacy, and basically the bridge that we built was antifungal stewardship. And so being able to identify whenever a test is positive and then notify the physician quickly is kind of the place where we came into therapy, and then also recommending therapy as far as de-escalation and also discontinuation when appropriate. With T2, it's very simple results. It's not like what you would see with procalcitonin or with lactic acid, where that a lot of things can impact it. With T2 being so sensitive and specific, there are not a lot of things out there that are going to interact with this test to give you a false positive. And the results are simple. It's a yes/no test. Whereas with procalcitonin, you have to measure serial levels and make sure that you're falling at a certain rate. And so it can get a little bit complicated for clinicians to understand, to make sure that those are ordered and then understand what to do with those results. So very simple. What we did at Huntsville is that empiric antifungal therapy could be discontinued if the T2 test was negative. So I would initiate a call to the physician to get that therapy discontinued. If the patient was not on empiric antifungal therapy, but T2 was positive, we actually had a pharmacy and therapeutics approval that the pharmacist could actually initiate antifungal therapy per protocol for those physicians, and then notify the ID physician immediately after initiation of therapy. So whenever you utilize this test and you take the test results and then you guide therapy based off of that, guess what? You're doing antifungal stewardship. And so that's how that we partnered with T2 in order to actually initiate our stewardship program with antifungal therapy, just because the diagnostics just weren't there yet for us. We were focusing heavily on bacteria, but with a test that makes it so simple, a yes/no answer, so quick to come back within 3 to 5 hours, and very sensitive and specific, it made it very, very simple for us to get that program up and running.